Hi friends, welcome to World Explorer India. Today we are going to deal with the Psychiatry Revision of Part 4. Amnesia. Amnesia is loss of memory. Retrograde amnesia means if any traumatic event is occurring to a person, that means if any road traffic accident or any damage or any injury to the brain is happening, this person is going to forget the events occurring after the incident. That is called as anterograde amnesia. Next is retrograde amnesia. It is exactly opposite of anterograde amnesia. They forget the events which are happening before the accident. Means before the traumatic event, if they are forgetting the things because of the brain injury, then it is called as retrograde amnesia. Next is postectal amnesia. Postectal amnesia means if person is forgetting the things which happened after the seizures or epilepsy is called as postectal amnesia. Selective amnesia means they are forgetting only few things which is selective, means the things which they doesn't like, they may be forgetting the things. That is called as selective amnesia. Dissociative amnesia or fugue means they are having no clear memory about the events, but they have some of the memory, but it's very vivid, it's not clear, then it is called as dissociative amnesia or fugue. Anosmia, it is lack of smell, means they are not able to smell anything, then it is called as anosmia. Anosmia usually happens because of some of the chemical exposure or some of the drugs or because of the symptoms of some disease. Next is aphonia. Aphonia means they are unable to produce sounds, then it is called as aphonia. Apraxia means praxis means related to movement. Apraxia means they are not able to do the purposeful movements, means if you are asking them to do some work, they are unable to do the work because they are unable to do the activity purposefully, they are not able to coordinate their body movements. Next is borderline personality disorder. In this type of borderline personality disorder, these persons are having very extreme decisions. Even for a minute thing they will take the extreme decision, means even for a small scolding they said that they are going to do suicide, or they may injure self, they may try to fight with others. So this is called as borderline personality. They are at extreme border, they will take extreme decisions, then it is called as borderline personality disorder. Next is burnout. Burnout is because of the severe stress. After the severe stress, this person is not able to get enough satisfaction out of the work what he or she is doing. Then these persons tend to get away from that work. That means they want to leave that work and they want to choose a new venue. Then it is called as burnout. This is very common in nurses because they work under very stressful environments. So even the medical health professionals, they work in very severe stress. So these persons are tend to leave their professions, then it is called as burnout. So burnout can be prevented with the help of coping strategies. So everyone has to develop their own coping strategies. They need to understand what will be the relaxing factor for them and they have to avoid the burnout. Next is crisis. Crisis is unexpected situation in any person's life by which they are not able to cope up with the situation. It is called as crisis. Even here the adaptive or coping mechanisms fail, then it is called as crisis. For example, let's take an example of earthquake. Earthquake is a crisis. Here their coping mechanisms fail to help them, they are not able to adjust with the real situation. Or for example, if a girl is marrying, then it is called as maturational crisis. So what will happen in this, they are trying to go into a new environment, they have to adjust with the new environment, so they may be having such type of problem. And next thing is situational crisis. If a person is losing a job and suddenly they have to cope up with the situation, then it is called as a situational crisis. Anticipatory crisis means any person who know that something is going to happen in nearby future. For example, if a person with severe illness, that is chronic illness, for example let's say cancer, that person know that that person is not going to live anymore, they can live only for a short period of time. So what will happen, this type of things will create depression in a person, then it is called as anticipatory crisis. Even the relatives, they may be knowing that if a person is not going to survive, and they will be started grieving. Means this is called as anticipatory crisis. Next is Dot syndrome. Dot syndrome is usually common in the Asian men, where they feel that they are passing semen in the sleep. Then it is called as Dot syndrome. They feel that they are feeling restless, they need some psychiatric support. This is called as Dot syndrome. Dyspareunia. Dyspareunia means whenever a woman want to have sexual activity, the muscles of the vagina tend to contract. Because of this, they will get severe pain out of the sexual activity. They cannot enjoy the sexual activity, but instead of it, they will be having severe pain out of it. Then it is called as dyspareunia. Fetishism. Fetishism means these persons are having sexual attraction towards the non-living objects. So it may be like clothes of a opposite sex person, or it may be some of the rubber materials, or it may be anything. So if they are having such type of sexual attraction which causes arousal in them, then it is called as fetishism. Next is pyromania. It is also called as fire setting. These persons like to put fire, and wherever they go, they try to put the fire and they will run away from the place. Then it is called as pyromania. Flight of ideas. Flight of ideas means they shift from one topic to another topic easily, and they will not be having a fixed concept. They will be shifting from one topic to another topic. That is called as flight of ideas. Next is gender identity disorder. Gender identity disorder means if in a family, let's assume all the children are female, there is only one male boy. So what this person will try to see, this person tend to observe all the women and he try to behave like a woman. Means they are not able to identify their gender. They cannot see they are male. They behave as if they are a female. Let's say take in the vice versa. If there is all boys in a family, there is only one girl, she tend to behave like a boy. Means here in gender identity disorder, they feel that they are from the opposite sex. This is called as gender identity disorder. Next is dual role transvestism. Dual role transvestism means they are wearing both the types of sexes dress. That is called as dual role transvestism. They wear both the type of dresses, either male or female. Next is grief reaction. It can be explained in a simple manner: DAPDA, Kubler-Ross reaction, denial, anger, bargaining, depression and acceptance. Histrionic personality. Histrionic personality means they are very dramatic and they feel that they should be the center of attention. They try to speak more and more, or they want to be the center of attraction. They will dress in such a manner so that they will be identified very easily. That is called as histrionic personality. Next is hypervigilance. Hypervigilance is very common in PTSD, that is post traumatic stress disorder. Means they are having some of the flashback, means they are not able to sleep. They will be very vigilant. They don't want such things to happen again and again. For example, if a person who has experience of something has been stolen from him, he will get up suddenly and he will see there is someone in front of him who is trying to steal something from him. Such type of things we see in a hypervigilance. That is a symptom of PTSD, post traumatic stress disorder. Next is hypnosis. Hypnosis is we are taking a person into a trance like state where we are able to suggest that person something. That we will be giving positive reinforcement, and what will happen after coming out of hypnosis, this person will tend to change his behavior. That is called as hypnosis, usually done with the help of some of the drugs. Iatrogenic. Iatrogenic is nothing but healthcare associated infection is called as iatrogenic. Kleptomania means stealing the things which they doesn't even need. It is just for fun they will steal. They doesn't need it. I have seen a student who steals chapel every day and other day, but he doesn't need them. He just steal out of fun. That is called as kleptomania. Now, mild mental retardation IQ score is 50 to 59, moderate mental retardation 35 to 49, and severe mental retardation IQ range 20 to 34, profound mental retardation, IQ score less than 20. This is very important question. Next is necrophilia. Necrophilia is love to the dead persons. They like the dead bodies. That is called as necrophilia. Premature ejaculation. Here they are not able to maintain the sexual activity. Male persons are not able to maintain the sexual activity for a prolonged period of time. That is called as premature ejaculation. This will lead to the partner dissatisfaction. Premenstrual tension syndrome. This is very common before menstruation in women. This is manifested by the symptoms of tension, irritability and depression, usually called as PMS, premenstrual syndrome. Promiscuity means they are having many partners in their life, then it is called as promiscuity. Rehabilitation means we are trying to bring back the person to the original phase. Before the disease, how a person is, we are trying to get back the person to the same stage, or else we are trying to make that person independent, means he is able to earn something for his livelihood. That is called as rehabilitation. Restless leg syndrome. This is during sleep they are not able to they are getting severe pain on the legs. Usually this will be relieved by walking. It is called numbness in the leg or whatever it is, but this can be relieved by just walking and moving the legs for 5 to 10 minutes. It is also called as nocturnal myoclonus or egg bomb syndrome. Next is stuttering. Stuttering means they are unable to pronounce the words in a immediate manner. Means if I want to tell this word stuttering, stuttering, like this they will speak. That is called as stuttering. Thought echo means whatever they are thinking, they are able to hear it back. That is called as thought echo. Thought broadcasting means whatever I am thinking, I am able to see that thoughts in the television or movie. That is called as thought broadcasting. Means if I am thinking something that is coming in the TV, then it is called as thought broadcasting. Thought insertion means someone is inserting their thoughts into my mind. I don't have this thought. This thought is of someone else. They are inserting this thought into the mind. That is called as thought insertion. Type A behavior is at risk for cardiovascular risk because these are very hard working persons. They work with very stressful situation. Under stress they have deadlines, they want to finish that work in the deadline. So such type of persons has such a behavior and they are at high risk of cardiovascular diseases in the future. Vaginismus, again it is same as like we have seen in the previous condition, where they are having a painful sexual intercourse. Reinforcement is a process by which we are trying to change the behavior of a person. It is type of motivation. It is positive or negative. If positive, we are giving positive reinforcement, the behavior will be chances of increasing the positive behavior. If there is a negative punishment we are giving, there is a chance of decreasing the behavior. This is the principles we use in behavioral therapy. If you like this, subscribe, share and comment. Do join my Telegram channel at t.me/norset. You can find the quizzes in this. So don't forget to subscribe and share to your well-wishers. Thank you.